Hi, welcome to this presentation called Digital Archives Save Lives, Preserving Documents for Public Health. I'd like to spend the next 15 minutes introducing you to the Opioid Industry Documents Archive, a joint initiative by the University of California, San Francisco, and Johns Hopkins University. My name is Kate Tasker, and I'm a librarian and archivist at the University of California, San Francisco, or UCSF. I'm here on behalf of a team of collaborators at UCSF and at Johns Hopkins University. And I especially thank Caleb Alexander, Saeed Chaudhry, Anne Seymour, and Rachel Takeda for their contributions to this presentation. In addition, I'd like to acknowledge and thank the teams at both UCSF and at Johns Hopkins University for their ongoing work and expertise in developing and supporting the Opioid Industry Documents Archive. I would also like to acknowledge the significant work done by state attorneys general, the courts, private plaintiffs and counsel, and community advocates who have called for truth and accountability about the opioid crisis and who have demanded public disclosure of opioid industry documents. At UCSF, we would like to acknowledge the Ramaytush Ohlone people, who are the traditional custodians of this land. We pay our respects to the Ramaytush Ohlone elders, past, present, and future, who call this place, the land that UCSF sits upon, their home. We are proud to continue their tradition of coming together and growing as a community. We thank the Ramaytush Ohlone community for their stewardship and support, and we look forward to strengthening our ties as we continue our relationship of mutual respect and understanding. The United States is in the midst of an opioid crisis, a public health catastrophe which has been called an epidemic and has resulted in the deaths of nearly 500,000 people since 1999, according to latest figures from the Centers for Disease Control and Prevention. The epidemic's first wave began in the 1990s with a massive expansion in the market for prescription opioids, and a second and third wave soon followed. As new consumers initiated prescription opioids, which are highly addictive, others moved from opioid pills to heroin, and then to even stronger synthetic opioids, such as illicitly manufactured fentanyl, with each wave of the epidemic building upon the previous one. The opioid crisis has devastated communities across the country and is often reported on in the media as mostly impacting the majority white population in rural and suburban areas in regions such as West Virginia, Kentucky, or Ohio. The crisis has undeniably taken a terrible toll on these communities. However, there's also been a huge surge in opioid overdose deaths in urban minority communities, and many scholars and public health experts have called out the responses from governments, healthcare organizations, and law enforcement as yet another example of racial disparities in the healthcare and criminal justice systems. There are many complex and intertwined roots of the opioid crisis, which public health and legal experts are more qualified to discuss. So I've provided a short list of resources at the end of this presentation if you would like to find more information. However, it is widely recognized that opioid manufacturers, such as Purdue Pharma, have played a major role in contributing to the epidemic through profit-driven, aggressive marketing and sales of prescription opioids like OxyContin. There are thousands of ongoing lawsuits across the country seeking to hold opioid manufacturers and distributors accountable. Huge settlements amounts have been reported in the media, including $1.6 billion in the Mallinckrodt bankruptcy and $4.5 billion in the Purdue Pharma bankruptcy. In reality, these settlements will only provide a fraction of the money needed to compensate devastated families, towns, and healthcare systems, to support treatment programs, and to rebuild communities. But thanks to enormous efforts by state attorneys general, other plaintiffs' lawyers, and community advocates, many of these settlements are also requiring that opioid companies publicly disclose millions of their internal documents in order to shine a light on the corporate decisions and actions that contributed to the crisis. So this is where digital library and archives practitioners come in. Colleagues at UCSF and at Johns Hopkins University, including librarians, digital archivists, technologists, scientists, historians, and community members, are building the Opioid Industry Documents Archive to preserve and provide public access to these documents. This digital archive will promote accountability and transparency about the causes of the opioid epidemic and can be used to take action to protect public health. Documents collected so far have come from lawsuits against Johnson & Johnson, Insys Therapeutics, and Mallinckrodt Pharmaceuticals, and from investigative journalism by Kaiser Health News, Stat News, and the Washington Post. The archive currently contains over 131,000 pages in more than 12,000 digital documents. An additional 1 to 2 million documents will be added in fall 2021, with more to follow. The goals of our archive are to consolidate documents publicly disclosed in opioid litigation into a universally accessible and easy to use free digital archive. Number 2 is to maintain the archive for long-term preservation and public access. And finally, number 3 is to increase support for scholarship on subjects including commercial determinants of health, pain management, addiction, conflicts of interest in the pharmaceutical and healthcare industries, and health policy. Archives can address many important questions from epidemiologists, social scientists, historians, policymakers, journalists, and many others who are investigating key questions about the opioid epidemic. For example, how pharmaceutical companies drove the epidemic, how marketing and promotional practices deviated from standards set by the Food and Drug Administration, and what changes in policy would be needed to prevent this kind of crisis in the future. The Opioid Archive expands on work at the UCSF Industry Documents Library, a digital repository of over 15 million documents which illuminate corporate influences on health. The Industry Documents Library began as the Legacy Tobacco Documents Library in 2002, which was established at UCSF to house millions of documents which had been publicly disclosed in historic litigation against the tobacco industry. The archive was funded with a gift from the American Legacy Foundation, now the Truth Initiative, with funds which had been made available from the 1998 Master Settlement Agreement against the tobacco companies. Now known as the Truth Tobacco Industry Documents, these materials have been cited in more than 1,000 publications and have supported significant scientific and investigative research, which has facilitated efforts to reduce smoking and related diseases and to improve health around the world. UCSF has expanded these collections to include documents from other industries impacting health, including the drug, chemical, food, and fossil fuel industries. These new opioid documents can be cross-searched with these other collections, providing unprecedented insight into previously confidential corporate records, which document activities and decisions related to governance, sales, marketing, lobbying, internal scientific research, product development, and regulation. In addition to their significant value for public health research and policymaking, these materials are also a rich data set for historical research, digital health humanities, and other computational analyses. This is a collaborative initiative which was launched in March of 2021 by UCSF and Johns Hopkins universities, but others are very welcome to join us. We are conducting outreach to library and archive students and practitioners, the digital humanities groups, public health researchers, investigative journalists, community advocates, people with lived experience of the opioid epidemic, and anyone who would be interested in making this Opioid Industry Documents Archive a success. We have also convened a national advisory committee with representatives from law, public health and policy, academia, journalism, community groups, digital libraries, and archives. Some of the many challenges that we face in building this archive relate to digital preservation, for one. The scale of the archive is enormous. The collection may potentially include tens of millions of documents or several terabytes of data. We're investigating and exploring the application of best practices for cloud storage, backups, fixity, managing original copies and use copies. We're holding on to a preference for open source platforms and tools whenever possible, and supporting community standards and development. and of course, managing and preserving a wide variety of file formats as part of this work. Another challenge relates to metadata, whether we continue to use item level metadata or move to some collection level description, considering questions of access, discoverability, and context. Many of documents do come with item level description, which has been provided through the legal discovery process. And so looking at ways to reuse any of that existing metadata or to enhance it with application of computational methods such as natural language processing or named entity recognition. We're also exploring the application of crowdsourcing or enabling community annotations to engage the public in describing and making sense out of all of these documents, and looking at linked open data to help us make this collection and these materials interoperable with other digital repositories to enable greater search and access. In addition, the documents come with significant privacy and legal issues. These internal documents contain information about employees, potentially about patients. And so we have a duty to protect third-party privacy and to screen and redact any personally identifiable information, or PII, or protected health information, PHI, which may be found across millions of pages of these documents. We also have to ensure that we're complying with state and federal privacy laws, and we will be managing metadata records for documents which have been withheld from public disclosure due to attorney-client privilege or confidential trade secrets. We've also need to consider sustainability and maintain the archive in perpetuity, but it is hard to tell exactly how long that will be. We are considering environmental sustainability and how to make sure that this archive is used appropriately and doesn't exceed the resources that we are able to collect to support it. We're also looking for long-term funding in order to support data storage, digital preservation, software and hardware upgrades, and staff and librarians for reference services and user support. Alongside these challenges come plenty of opportunities, which are very exciting, and we look forward to discussing those more with interested groups and participants. We're excited to advocate for digital archives as a vital public health and health justice resource, to continue supporting open source technology and contributing to digital preservation and access initiatives, to support digital humanities and computational research, to enable community work and annotations, potentially using the International Image Interoperability Framework, or IIIF, and increase public engagement and knowledge across all of these areas. I've included this slide with a few additional resources that I mentioned earlier to get a better sense of what's happening with the opioid crisis and the impact of public disclosure of documents. And I thank you for joining this presentation. Please visit the Industry Documents Library website for more information. The URL is www.industrydocuments.ucsf.edu/opioids. And I look forward to talking with you more after this session. Thank you.